Good evening, everyone. A very happy evening, I would say. If you or anybody you know have a parent who's elder, then this talk is for you. As a doctor, we are trained to save lives, to take decisions under pressure, to diagnose symptoms, to treat patients, and work under stress. But nobody in medical school trains us for the quiet pain of an elder mother who gets admitted again and again in the hospital for minor issues, looking more confused, more overwhelmed. And nobody teaches you in medical school for the son who flies in late from another city or country and whispers in the ears, I wish I had done some more. And nothing trains in the medical school for the moment you realize that this hospital bed was exactly what she didn't need. During my medical training in the US, I saw some amazing elder care systems, well planned, very well coordinated, very well thought, people centric, and not just around procedures, where patients were actually given comfort, where decisions were taken out of love, and death was taken with honor and dignity and not just fear. I loved coming back to my country, India, to serve. I was very proud, but what I saw broke my heart. Older patients were just treated like cases. Families were overwhelmed and very underinformed. I still remember that death was a taboo to talk, and even now I can feel that. We don't have necessary but difficult discussions. We make decisions out of fear and not out of love. She needed home. She needed healing. And most importantly, what she needed was dignity. And that became my purpose. That changed my practice. That changed my perspective. Bharat is changing very fast. As per national and international studies, by the year 2050, we'll have more than 300 million Indians above the age of 60 years. Trust me, that's much more than most of the country's population in the world. But are we ready? Our systems are still caught up. We haven't changed. We are still thinking of aging like a crisis and not as a phase of life which needs coordination, planning, and supporting care. When will we change? Are you not looking to transform India? Are you not looking to transform a situation wherein aging is considered like a phase of life and not a crisis? Where panic is changed into planning and fear into familiarity? And that's my vision. A vision which we work for to provide elder care at home. To build a deeply well-structured ecosystem which is scientifically backed, evidence-based, but completely filled with compassion and empathy. A home healthcare model for the elderly people, where patients are given medical importance, but emotional importance and stability is equally prioritized. Where families are not left behind, but kept in control of all the decisions. Where system is scientific and evidence-based, but delivery is 100% empathetic. And that's the vision we all believe in. Because that's an ecosystem wherein all forms of healthcare, whether healthcare professionals, doctors, caregivers, nurses, allied professionals, they work as a team, and delivery is compassionate. Where aging is considered with grace and not with fear. I still remember, I'm sure you must have seen or witnessed your grandparents. I recently met, almost 2 years back, I met a lady, a Sikh by profession, a Sikh by religion. Her son came to my outpatient and said, Dr. Charu, most of the doctors have said she doesn't have time to live. What should we do? We wish to take her home for the last breath. And I replied, it's never you, me, or any doctor deciding the last breath. It's only God. It's only her time. We should focus on the healing. We should focus on what she likes. We should focus on the care, the comfort. But along with that, back it with science. Because home is where healing is. Where photos hold memories. Where silence isn't sterile, it is sacred. And thankfully, with the help of the entire science, technology, and care at home, yesterday was the day she went to the Gurdwara by her own steps. That is the power of care at home. That is the power of elder care at home. And that is the power of healing at home. I've seen many times parents hardly complain when their kids move out of the country for education or work. They don't complain, but I've witnessed their silence. Their silence, which is not of strength, but it's of longing. And I've also witnessed a guilt in the children's eyes, which no video call in the world can erase. And that model of home healthcare for elders restores trust. Because on one side, the children feel happy that their parents and elders are well taken care of, supported, cared, and very well medically informed. And elders can age with dignity, grace, and not with fear. Would you not like to have this transformation? Would you not want that elders don't live with fear, but with familiarity, with compassion and care? Let me turn now to some questions on you. How many times have we actually discussed some difficult but necessary conversations with our parents about aging, about death, about how they wish to die? How many times have we thought as a citizen to change the aging crisis in India? We are becoming a grey tsunami. We are becoming a grey nation. But are we changing something about it? Are we equipped to take care of this? If you are a healthcare worker, it's not your duty to just take care of an elder citizen as your duty, but as a devotion. As a family member, the way we plan our big fat weddings and careers, shouldn't we plan our parents' aging? As an innovator, is it not our responsibility to think about some tools and platforms and artificial intelligence to provide scientific yet comfortable home care models for our elders? And as a policymaker, is it not our responsibility to question them, to make elder care at home not a privilege but a right? We have always taught as Indians to take blessings from our elders. We worship them. We seek blessings by touching their feet. Let's not abandon their care when they need us the most. Let us bring their care home. Let us change from crisis to compassion and fear to familiarity. Because what I have witnessed is that dignity is the biggest currency in healthcare. And where photos hold memories and smells are familiar, that is home. And home is where healings belong. Thank you.